Good afternoon, everybody. My name is Dave Kerner, serving as County Mayor here in Palm Beach County. I'm joined by several colleagues that sit on the Board of County Commissioners with me. To my left, Commissioner Mac Bernard. We also have Vice Mayor Robert Weinroth and Commissioner Greg Weiss. We have Captain Kirshner from the Palm Beach County Sheriff's Office on behalf of Sheriff Rick Bradshaw. I'm also joined by Department of Health Director Dr. Lena Alonzo and our County Administrator and Incident Commander, Ms. Virginia Baker. I want to go over some very brief statistics, but before I do that, I will tell you that we will have comments today by the Department of Health Director, Dr. Alonzo. We'll have comments from Mr. Bill Johnson, our Emergency Manager for Palm Beach County. We'll also have comments from our Incident Commander and County Administrator, Ms. Virginia Baker. And we'll also have an opportunity to hear from the elected county commissioners that are present here today about this transition point that we're in our community with regards to the vaccine. As we sit here today, we have a positivity rate in Palm Beach County of 7.3%. We remain above the 5% and below the 10%. However, the statewide positivity rate is certainly more concerning, which sits now at 14.53%, and that's a representation of the spread of the virus and the prevalence throughout the entire state. Today's update is to provide you the latest information on the initial phase of the COVID-19 vaccine distribution plan in Palm Beach County. There are 3 priority operations that have started or will start in the near future. By next week at the latest, the Florida Division of Emergency Management and the Florida Department of Health are overseeing or monitoring all these operations in conjunction with our county structure as well. I'm going to ask now Dr. Alonzo to come to the podium to give us a bit more detail on those operations and what we should anticipate seeing in the near future. Doctor?
Thank you very much, Mayor Kerner. It's my pleasure to be here with you all again here today. It was just a few days ago that I talked to the Board of County Commissioners, and I said to them that even though our rates were nice and low on that one day, and I actually got a 5 on a positivity rate of 5.72 on Sunday, that I expected those numbers to go up. I also, we were having, on that same Sunday, we only had 367 cases, and I said we felt very lucky that Sunday. I explained that my numbers that I'm expecting through December into January are up in the 700s and 1,000. And actually for the past 2 days, on Wednesday the 16th, we had 766 new cases. On Thursday, we had 754 new cases. So those are what we are expecting. That's what our contact tracers will have to be working on. We have hired more contact tracers at this point to be able to get us through these higher numbers. But again, once those numbers go above 5, contact tracing is very difficult. So our ability to decrease the spread will be hindered by those numbers. So we expect there to be more positive people as a result of it. Our numbers in terms of the hospitals, you know, we've mentioned that Bill and I go to we meet with the hospitals. I'm sure that all of you are concerned because you're seeing those numbers go above the 75 for the total hospital beds. They've been above the 76, 78, 78, and as of Friday they're at 77.8. Those are high numbers. However, the hospitals have assured us that the number of COVID beds have remained in the 5%. The total number of ICU beds are at 73.4% today. That is still below the 75%. And those numbers have remained around an average of about 17%. The last 2 days it's been at 18.3 and 18.8. But again, the staff at the hospitals have said that so far they're able to handle this. Their concern is as they go forward that they will have shortage of staff because staff is burnt out. They've been working lots of hours, and as you know, as more people come into the hospital with COVID, that means that there's a higher level of acuity with these patients, and they have to therefore assign them more one-on-one. So they're concerned, but we are not alarmed at all at this point, and we definitely do not have hospital surge at this point. So we're going to keep an eye on that. We will keep you posted, and we will be watching that very carefully. Now, the positive and the exciting part of everything that we're working with is the vaccine. So the vaccine coming into Palm Beach County will be delivered to the county health department. We are in charge of that vaccine, and we will be handling the distribution of that vaccine. There are 3 components of the vaccine right now. Are you guys hearing me okay with the mask? Okay. There's 3 components. One is the hospital healthcare workers. The Palm Beach County hospitals are expected to begin receiving deliveries of Moderna vaccine next week. That's the same kind of vaccine that we are receiving for our operations in terms of the next level that we will be handling. We will be handling, that vaccine will be coming to the county health departments at designated sites, and then we will be dispersing that vaccine out to fire rescue, EMS paramedics, our county health department frontline and healthcare workers. We have 8 county health departments that have been delivered this amount of vaccine. We are now updated today that we will have 18,000 doses of the Moderna vaccine. We can keep that for 4 weeks. We will be working those 4 weeks to roll this out to fire rescue, EMS, paramedics, our county health department frontline, and healthcare workers. We will be rolling that out. Obviously, everybody cannot get the vaccine at the same time, so please be patient. The nursing homes are being handled completely and 100% by the CVS and Walgreens are the exclusive providers, and we have requested that we find out allocation as well as dispensing information on a weekly basis from them so that we can keep everybody appraised of which nursing homes, which long-term care facilities have been inoculated, and you know how it's going. The same thing for the hospitals. There's allocations now that there'll be a dashboard where the hospitals will know how much they're getting and how frequent that is coming. This will continue to roll out on a weekly basis. The vaccines that we're getting now are for the first vaccine. Okay, so we don't have to divide that. A lot of people mean, does that mean that you have to save half of it? No. These are 18,000 vaccinations that we will be able to give out here in Palm Beach County. And that is the first line that we're going to use. Fire rescue, EMS, paramedics, our county health department, frontline staff, and healthcare workers. 8 of those counties have received this vaccine in different amounts, and they are Palm Beach, Miami-Dade, Escambia, Leon, Duval, Orange, Seminole, and Lee County. I don't have the amounts for each county. I'm taking care of Palm Beach, so that's how many, I know how many we have only, okay? So that is it. Very basic changes are occurring every day. We have plans and how we're going to get all these people vaccinated. Some we will give them vaccine. If they're in Florida shots, we can give them the vaccine. They will be able to inoculate their staff and then enter that information in Florida shots. If they don't have Florida shots, we will be able to actually vaccinate them, and then we will enter that into Florida shots. It is essential that all the vaccine gets entered into Florida shots. That's how it's going to be tracked. That's how it's going to be targeted for information going back. When you get the vaccine, you will get a card that says what the make of the vaccine that you got, the lot number, other information, just like every vaccine that you get, and it will also give you the date that you're going to get that second appointment. For Moderna, it is specifically 4 weeks apart. Pfizer is 3 weeks. We're going to have the Moderna. So you're going to have your appointment, let's say the vaccine's coming around the 22nd. Let's say you get it on Christmas Eve on the 24th. Your next appointment is going to be 4 weeks from the 24th in January. Okay? So that's how it's going to work. We're going to text, we're going to email, whatever method you want us to reach you, so make sure that you come. Please get your second vaccine. The vaccine works with 2 shots. There's another vaccine that works with only 1 shot. You're not going to have the full coverage if you only get 1 shot. The idea is you get the 1 shot, you wait 4 weeks, you get the second shot, and your antibody response goes up. That's what you want to have in order to get the 94 or the 95% efficacy of the vaccine. That's how it's created. Please follow those instructions, and we can make the vaccine work the way it's supposed to. That's all I have. We go ahead and take other folks in order.
Thank you, Dr. Alonso, for your continued leadership and willingness to communicate directly to the public. I can promise you, as we have in the past, this unit of government, county government, along with the Department of Health, will continue to communicate with our residents and constituents as quickly as possible after we obtain that information. We know how important it is to keep the community informed, and we appreciate the press's coverage of these important issues as well. The COVID-19 vaccines, I want to remind the public that when they are here for the general public, they are free. And they're an important tool to help stop the pandemic, but we continue to have in place our mask mandate in this county. We completed our second round of direct mail to 600,000 residential home addresses in this county and delivered over 1.4 million masks to our residents. Palm Beach County also has a very robust testing structure in place, as we've had from the very beginning, starting in March. And we remind our residents and constituents how important testing is in terms of not just for your own public health and safety, but also those around you in terms of contact tracing and knowing what the positivity and prevalence of COVID-19 is in our community. The government-operated sites will be closed on Christmas Eve, Christmas Day, and New Year's Day. We're now to date 277 of EOC activation at level 2. And with that in mind, I'd like to invite our emergency manager up, Mr. Bill Johnson, and then we'll hear from our incident commander, Ms. Virginia Baker. Mr. Johnson?
Thank you, Mayor Kerner. Really appreciate it. The vaccination situation here throughout the state is a fluid and rapidly changing process. Our plans are based on state and federal guidance. Since day number 1, Palm Beach County has worked to establish and maintain a strong relationship with Governor DeSantis' office in Tallahassee, the Florida Division of Emergency Management, the State Emergency Operations Center, and the Florida Department of Health. We believe that these relationships have better prepared us to respond throughout this process and the pandemic. Although the situation is ever-changing, we believe that we are very capable of pivoting whenever necessary. Palm Beach County Division of Emergency Management and the Emergency Operations Center are partners with the State Emergency Operations Center, with the Department of Health, in serving a supportive role in the entire vaccination process. We are working to coordinate the resources that will support this effort to facilitate vaccination in the most efficient and expedient manner possible. We are here to support Dr. Alonso and her team in this process. I'd now like to invite Ms. Virginia Baker, Administrator and Incident Commander, to the podium. Thank you.
Good afternoon, and thank you for being here. I'd like to thank the media for their partnership throughout this pandemic, because you have been instrumental in continuing to encourage our residents to wear their mask, do the distancing, etc. So we really want to thank you for that and for being here today. You've heard about the vaccine. We've reiterated the fact that you need to continue to be tested, and the test sites will still be up and operational, with the exception of the days that were highlighted. I want to talk to you further a little bit about the CARES dollars, because there have been a lot of questions about the CARES funding. We received the funding. We are in very good shape on expending those funds by the deadline given through the federal government. Our Palm Beach County Cares Restart Business Grants to date, that program has now submitted for payment for all eligible applications that have resulted in a total of approximately $79 million, 5,182 businesses in Palm Beach County. This funding was made available to businesses affected by COVID-19, available to be utilized for expenses needed to keep businesses in operation. That would include helping them with their commercial lease or their mortgage payment, inventory, salaries, personal protection equipment as well. The business grant program was to assist small businesses throughout the county, including those that did not receive COVID-related funding and other funds from other entities. More than 99% of our grantee businesses had 25 or fewer employees. More than 73% of business grantees gross receipts of no more than $250,000. Approximately 60% of the businesses received no other COVID-19 relief in the form of forgivable loans. I'd like to thank our partners that have assisted us throughout this process, and that is our staff here in Palm Beach County, because it was a cross-departmental lines to get this task completed, our clerk of courts and her staff, along with the tax collector's office. It has been definitely a task that we thought was definitely going to stretch us, and it did, but we were in good shape to get those businesses those dollars. Palm Beach County Cares Mortgage Assistance Program to date has distributed an additional $11.3 million that will assist roughly about 1,500 households. Further, we've got 134 eligible applications that are also still being processed and has been submitted to the clerk for payment. So that information, those fees will also be paid. In addition, we have expended roughly about $39 million in food for our community, and we have provided for rent and utilities nearly $23 million and allocated $4 million to our local nonprofits. So we are in very good shape. We have also expended dollars with our municipalities. So we will be in a position where all of the CARES dollars that was sent to Palm Beach County will be expended here in Palm Beach County. There will be no funds returned back. So thank you. Mayor.
Thank you, Ms. Baker. We appreciate your steadfast leadership and direction of this county in conjunction with the Board of County Commissioners. And in that regard, it's my honor to invite to the podium our elected county commissioners. We'll start with Vice Mayor Weinroth and go to Commissioner Bernard, Commissioner Weiss, and Commissioner Sachs in that order. And so we'll just continue down the line. Commissioner Bernard, or Vice Mayor Weinroth, sir.
Thank you, Mayor. Our residents in Palm Beach County can really take pride in the way that our county has responded to this crisis. 277 days you heard today as Mr. Johnson spoke. Our county has been able to address this pandemic, and we've effectively been able to hold down the positivity rate. We have a miracle in front of us now in a vaccine that took less than a year to produce. The vaccine for polio took 23 years. We are going to be in a position now where hopefully by the end of this next quarter, we're going to have everybody vaccinated who wants to be vaccinated, and we can get beyond this pandemic. So I thank everybody, our residents, our staff, and everybody who has lent a hand to get us through this pandemic. We can do it, and I wish everybody a very happy, healthy, and safe holiday. Thank you.
Thank you, Vice Mayor Weinroth. My name is Mac Bernard, County Commissioner for District 7. As you heard from Dr. Alonzo, Palm Beach County is going to receive 18,000 vaccines, which means that the information is fluid, and we're going to continue to work every day to provide the public the correct information in regards to vaccination. We look forward to working with the Health Department, the Palm Beach County Healthcare District, our county, so in that way we make sure that our residents are vaccinated, and we're going to make sure also that we distribute the vaccinations equitably throughout Palm Beach County. Thank you.
Good afternoon. I'm Greg Weiss, County Commissioner, District 2. To all of our residents, I just want to remind you, even though we have the vaccine on the horizon and it will be here next week to begin the distribution, it's important to still wear your mask, to still social distance, to stay away from crowds, to continue to practice the mitigations that we've all learned over this past 10 months. We're not there yet, but the light is at the end of the tunnel. Specifically to our communities of that have been economically disadvantaged, some folks that don't speak English, to understand that you will have access to these vaccines as well. There is no charge, and there is no identification that's going to be required. So this vaccine is going to be available to everybody in Palm Beach County. And as everybody else has said, I want to wish all of our residents a very happy, healthy, and safe holiday.
Thank you so much, Commissioner Weiss. My name is Maria Sachs. I represent District 5 of this wonderful county, and I'm the newest county commissioner. I stand here in awe, having just been here barely a month, at the work that our county has done, and the people behind me, that our county commissioners, what they have been able to mobilize against the greatest pandemic that this state has ever seen in 100 years. Yet, the people behind me, with the help of Administrator Baker and our county health department, mobilized in an almost military fashion to get the greatest majority of people tested. Now we're faced with a second challenge. And that challenge is to make sure that everyone in Palm Beach County who wants to will get this vaccination, not once but twice. It is important that folks know that even if they get the first shot, they got to hold on, keep your masks on, do all the things that we've been doing for the last number of months, and wait till you get the second shot. And after the second shot, as they say, the experts, the person who gets a second shot should be pretty much free and clear of getting it again. So now we have that challenge, and I know that the people of Palm Beach County will rise up and make sure that they get the vaccination. We are very lucky to have county commissioners like we have today, a good health department, but we are especially lucky to have the people of this county respond so well to this greatest challenge we've seen in our lifetimes. So to everybody, as we end the period of the Festival of Miracles on Hanukkah, and we look forward to Christmas, I wish everyone a very safe and happy and healthy holiday season coming up. Thank you very much. Thank you.
Thank you to my colleagues on the Board of County Commissioners, and I don't think there's anything else that I can say that hasn't been said by my colleagues, and particularly the closing comments by Commissioner Sachs, our newest member, who we're honored to have here today, but her words were right on point. We wish you a Merry Christmas. I just finished Hanukkah. It was a heck of a holiday, but it was a different one. And we're going to have to be used to that. We're going to have to understand that as we go through this winter period, Christmas is going to look a little bit different. The way that we gather with our families, the love that we have for each other won't change, but the way we express it and the way that we celebrate these incredible times will be a little bit different. Having said that, I'm happy to take any questions, and we'll go from there. Yes, sir.
Two for Dr. Alonso.
Absolutely.
Hello,
Hi, Doctor.
how are you?
First question, have you seen a discernible increase in cases that, based on your contact tracing data, you trace back to the Thanksgiving holiday, either to families gathering or to travel?
Yes, that's a short answer. The question is, have I seen a considerable increase in the number of cases based on Thanksgiving, especially the increased people that traveled, people that had large gatherings in their home. They thought they were safe, but somebody from somewhere else came along with somebody, and that was probably the person that infected them. We get a lot of that information when we do our contact tracing, and that's why throughout the nation we continue to say you need, please, avoid the 3 C's. Close contact areas, places where you can't distance apart, closed-in places with poor ventilation, and anywhere where there's a large crowd that you're on top of each other, please stay away from those places. Do not, because somebody will be in there with COVID, I guarantee you, and that person's going to spread it to you. So please, despite the vaccine, despite everything, just keep those 3 C's out of your equation, and please stay very safe during these holidays. We want to be here next year and with your loved ones next year.
And my unrelated second question is, have you seen any vaccine doses from the Pfizer shipment make their way up from Broward County hospitals up to Palm Beach County?
No, Palm Beach County is specifically being given the Moderna vaccine. It's much easier to handle. It also has a very good, efficacy, and we're very happy to have the Moderna. They're going to try to keep us with that same, the same brand, so that it doesn't become confusing to people. So the question is, have we seen the Pfizer being given out to our hospitals? And the answer is no. The only exception to that is the corporate hospitals that have allowed staff from here to go to Miami and to Broward to get vaccinated. So those folks did get the Pfizer.
That has happened, like if hospitals that have branches up here have sent staff down there?
Yes. Okay? All right, thanks.
All right, barring any other questions, we look forward to communicating with you in the near future. We will, yes, sir.
Sorry, I don't mean to monopolize.
No,
I've got
please.
one more for Ms. Baker, if you don't mind.
Yes, sir.
Ms. Baker, would you mind, could you elaborate for me if you believe, and I'll open this up anyway too, is the county concerned about the Turning Point Conference slated to begin tomorrow at the convention center?
The question was if the county was concerned about the Turning Point Conference that will begin here in Palm Beach County tomorrow. Yes, we're always concerned about large crowds coming in. So we have been working, our convention center general manager has been working with the organization. They have an agreement. We expect us, the county, to live up to our agreement and for them to live up to theirs. We have a mask mandate in place. We expect people to adhere to the laws here in Palm Beach County.
And could you elaborate for me a little bit on the decision-making to close something like the Garlic Festival, for instance, but allow not just Turning Point, but just in-person conventions in general?
Well, I think the governor's executive order kind of took some of those decisions away from the county. The county permits our park system and activities that occur in our park system. We are discouraging large groups from gathering. And so it doesn't make sense for the county to permit such large things in our facilities. And so therefore, we did not permit it. We do look forward to continuing to work with the Garlic Festival and the Seafood Festival. And I am hoping that in 2022, when it's time to roll around, we'll be in very good shape to host those events again in our venue. Okay? Thank you.
I have one for the mayor. This is in response to the governor's visit here earlier this week and his comments about cobbling local efforts to maybe mitigate the coronavirus and close down businesses. Obviously, we're not out of the woods yet. Just what's your response to those comments? I'm not sure if you listened to the entirety of the press conference that he had.
I did, and the question was, what are my thoughts, I guess, as the county mayor with regards to the comments made by the governor during his press conference at Okeechobee Steakhouse here in Palm Beach County, which I believe occurred on Tuesday at about 3:30 p.m. I had an opportunity to speak with the chief of staff to the governor, and we share perspectives. I mean, I can tell you, first of all, that we've learned an incredible amount from day one up until where we're at about what influences, what levers, what buttons we push and use as government to help control the spread of this of the virus, but at the same time realizing what the impacts are to businesses, unemployment, and things of that nature. And there's a tension and there's a balance between it. I think what we see the governor saying is we don't want to unnecessarily prejudice business and people's jobs, and that's a perspective that this entire board agrees with. And I can tell you that when you look at Palm Beach County, with the lack of authority we have right now, the county's residents are conducting themselves, regardless of government mandates, in a responsible way. And we maintain our positivity rate below 10%, they're much higher in Broward County. They're 50% higher in Broward County and 100% higher in Miami-Dade County. And we're doing this without the need right now to have to shut businesses down or regulate them into not having a business future in this county. And that's not something we want to do. I think that if we were to get to that point where government intervention was called for and is pragmatic and is used as a scalpel and not a sledgehammer, then we will have that conversation with the governor on behalf of the board about what powers we need to help control the spread of the virus. So I don't think that I'm personally at odds with the governor in any way about what he said, and to a greater extent, I support the concept and the vision of not over-regulating our businesses and to not having a business any further.
Does that stand true as well for his comments on the mask mandate and the lack of a need for a statewide one?
The question was, do I share the governor's perspective on the lack of mask mandate? Is that fair?
He made it clear at Okeechobee Steakhouse that he was not a fan of a statewide mask mandate, despite there being a countywide one here.
And I think that's the governor's prerogative. This is a broad, large in population and large in size, large demographically, and there are areas in the state that don't need a mask mandate. Most of our mask compliance in this county is voluntary, quite frankly. We do have a mask mandate, and look what's happened in our county. Our positivity rates are very low. So it's not my place to tell the governor how to do his job. He's got a big state to govern, but we're a local official. We want a mask mandate in our county. He's allowed us that discretion and authority, and it's something that I'm very appreciative of from the governor. All right, with that said, Merry Christmas, Happy Hanukkah. We will continue to communicate directly to you, and we remain available for questions from members of the press and our constituents at any time. Thank you very much.